Place the patient supine on the operating table with their arms to the sides. Position the bed to 10 degrees. This will decrease the risk of air embolism by engorging the subclavian vein. Attach the EKG to the patient. Place the small rolled towel between the shoulders to make the clavicle more prominent. Use of a Doppler here can aid in finding the subclavian vein. Using a spiral method, scrub the clavicular area with chlorhexidine for 60 seconds. Flush the lumen of the central line with saline. Ensure the longest lumen of the central line is cap-free and that the guide wire passes easily through it. Infiltrate the skin with 1 milliliter of lidocaine just lateral to the posterior bend of the clavicle. Insert the needle into the skin at the lateral border of the clavicle while pulling back on the plunger to apply negative pressure. The vein approximates the clavicle where it bends posteriorly. Direct the needle towards the suprasternal notch. Insert the guide wire into the needle and progress carefully into the subclavian vein. Stop the insertion of the guide wire when the EKG monitor shows an arrhythmia. Arrhythmias indicate that the guide wire has reached the heart. Use the scalpel number 11 to make a small incision in the skin next to the entry point of the guide wire to facilitate placement of the dilator. Place the dilator over the guide wire and advance it 1–2 centimeters into the skin while rotating. Ensure that the dilator does not bend or kink and control the guide wire at all times in order to prevent a wire embolism. If there is excessive bleeding, place the gauze over the guide wire entry site and hold pressure to control bleeding. Place the catheter over the guide wire and begin to insert the catheter using a rotating motion. Always ensure control of the guide wire. Use the syringe to flush all ports on the catheter. Use the suture to secure the line in place. Apply the sterile dressing over the site. Auscultate breath sounds and observe respiratory rate to ascertain there is no large pneumothorax. Obtain a chest X-ray to check the line placement and to confirm no hemothorax or pneumothorax has occurred.